just some simple neck circles. Now, as you guys all know, all of the nerves in your upper body come from your cervical spine, which means your neck. So we're going to make sure that the neck is moving nice and clean. Hey guys, Dr. Will here from Miami Spine and Performance. One of the common conditions that I see a lot in my clinic is carpal tunnel syndrome. But what a lot of people don't know is carpal tunnel symptoms can be coming from somewhere else other than the carpal tunnel. So typically carpal tunnel syndrome is pain in the hand associated with numbness, tingling, weakness. Patients usually describe difficulty opening jars and doing kind of fine motor tasks, clipping their nails sometimes. And this is the carpal tunnel right here. However, that nerve, the median nerve that causes those symptoms, can be trapped in a number of different places, from the thumb to the forearm to the shoulder to the neck. So I'm going to show you guys how to kind of move this nerve around in a healthy, safe way to not only prevent carpal tunnel, but if you're starting to feel early onset of maybe some tingling in the hand, you can use these as a way to kind of kickstart your recovery before you go in and see a physician. So the first thing that you're going to do is just some simple neck circles. Now, as you guys all know, all of the nerves in your upper body come from your cervical spine, which means your neck. So we're going to make sure that the neck is moving nice and clean. If we have any issues in the neck, that can cause symptoms all the way down to the hand and all the way down to the fingers. Now, when I show patients how to do this, typically what they'll do is they'll do this, right? The problem with this is I'm facing forward the whole time. You want to make sure that you get that good rotation. So I'm going to roll and look over my shoulder and look over my other shoulder as I go through this range of motion, just like this. Okay? You might feel some creaking, you might feel a little bit of discomfort. Don't push too much into the discomfort, but the more you do it, generally, the looser that you're going to get. The second one we're going to do is a sunrise salute. So this is going to help kind of open up this area here, the brachial plexus, where that median nerve comes from. We're going to put our hands together, reach up to the ceiling, and open like so. Hands together, reach up, and open like so. We're going to make almost like a field goal sign. Okay? Hands up and open. The next one we're going to do is what's called a median nerve slider. So I'm going to have my hand and my head together. I'm going to just open and close, spread my fingers. Now, it's not unusual for you to feel kind of a reproduction of some of that tension or tingliness. As long as it doesn't linger after you're done, it's okay. So hand and head together. Just like this. We'll do that on both sides. Even if you're having just some symptoms on the one side, you might as well just keep both sides even, and that way you have a good point of comparison as well. The next one we're going to do is some elbow cars. So this comes from functional range conditioning. So what I'm going to do is I'm going to lift my elbows up, turn them down, and extend. Open, curl, rotate, just like this. This is going to make sure that my elbows and my wrists are moving in a healthy way so that they're not blocking any nerve conduction to the hand or to the fingers. Okay, we're going to do about 10 of each of those. The last one we're going to do is called an ulnar nerve glide. Okay, so now we're going to work on a different nerve that goes to the outside of the finger. So what I'm going to do is I'm going to put my hand and my head away from each other, and then I'm going to bring my hand like so and point away. Bring my hand like so, point away. Okay. The other way you can do it is you can do an owl eye. So I can go here and I can actually do like this and point away. Make an owl eye, point away. Right? So that's going to floss out the ulnar nerve. So if you have any sort of medial elbow pain, maybe some golfer's elbow, or if you're getting into those symptoms into the pinky, you want to make sure that you're stretching out your pinky in this position as you're flossing that nerve. Okay? So those are a few exercises you can do on your own, nice and simple. Take 5 minutes a day. If you are starting to feel a little bit of tingling in the hand, or you're feeling a little bit of weakness, and you don't want this to get significantly worse, where God forbid you could end up getting surgery, start now. Start preventing these things now with some simple exercises. Tell your family and friends, and I'll see you next time.